Joanne Page from the Fortune Society. There's a leg to the stool or a driver to the system that didn't get talked about, and that's the Department of Corrections as a means of sucking people out of the shelter system by locking them up, and as a means of generating homelessness. And I'm wondering if you have that in your plan, and if so, how?
The question was from Joanne was to ask was how are we thinking about the role that corrections plays in this population when they're diverted to corrections and put back? I don't know.
Well, that I know a little bit about too. That wasn't a setup, I want to just say.
They're all planted, every one of them.
But there's a couple of things that I think are important. On a very sort of micro level, one of the things we're going to be doing is putting HRA staff on Rikers Island to deal with a lot of the same issues that led us to say, okay, shouldn't we have staff directly in the shelters, because all of the traffic is driven to that same center on Northern Boulevard, or that same series of centers on Northern Boulevard where people are released without having anything. So we want to take a more proactive approach to helping people who are being released and getting them more effectively situated in their communities. But I think the mayor's task force looking at sort of the intersection of mental health and corrections and other agencies, including HRA and DHS, is an important step forward along the lines of what Commissioner Taylor and I have been talking about, which is the concept of the city looking at things as city problems rather than agency problems. Mm-hmm. And so I think that task force's focus on what are the drivers of people who are intersecting with HRA, DHS, and the prison and the Department of Corrections who have mental health needs in particular. What are those intersections, and where do we have a better chance to make interventions that are going to be meaningful? I mean, as the mayor said very eloquently, look at the data of what the population is in Rikers, and it's not so dissimilar from the population that ends up coming into the shelter system in terms of mental health needs. Mm-hmm. And in terms of people coming to HRA and perhaps facing barriers that are difficult to address with those mental health needs. So I think this is another example of actually agencies under the guidance of the mayor and the deputy mayor saying, you know what, we can do much better, and let's address the problem. I think there'll be some good concrete solutions coming out of that, and next year at this conference, you could have the Department of Corrections up with us too, and we'll talk about how well those proposals actually worked.
My name is Kevin Muir. I'm with an agency called CAMBA. We're actually a provider of health home services as well as shelter services. But I'm wondering, with all the Medicaid redesign processes that have been happening in the state for the past 3 years, what sort of policy issues are you guys working on to sort of work alongside of those? It sounds like you're working in a very collaborative way across agencies in the city, but we also need to look at how we can bring in some of the Medicaid redesign processes. And I know that as a provider, we come across a lot of policies and regulations that sometimes feel like they're working against what we're trying to accomplish in some of the Medicaid redesign programs. So I just wanted to put that out there and see what you all thought about changes that might occur around.
So in case you all in the back didn't hear, the question was essentially about how do you think about incorporating the overarching change in policy around Medicaid redesign within the systems that these guys run, both at HRA and Homeless Services, which are obviously driven by the state, the Medicaid piece.
I mean, from what I've been involved in so far at HRA, one of the first places that we've gone is to reach out to the state and actually reconnect the relationship on the Medicaid redesign issues, because I think the prior administration sort of took the perspective of, all right, it's going to be a state takeover, so be it. And I think we have a different perspective, which is we're a strong local presence. Yes, the state is running it, but there is a partnership role that we have with the state, and we're looking forward to working with them. There are different populations involved, the Magi population, the non-Magi population. They have different needs. The outcomes of how they interact with our system and other systems may be drivers into the DHS system, and so that's been one of opening up the dialogue with the state. I think the state was all along willing to have the dialogue with the city, but I don't know that the city was was there, but under the current administration, we're definitely there, and we've reached out to the state to work through how we're going to be most effective partners in that area. But I think you raise a very good point about the intersection of healthcare and all of this.
But with the high utilizers, just to continue on that for a second, with the high utilizers and anybody that's connected to a health home, Commissioner Taylor, do you see a scenario where you would actually mandate that vendors in your system actually demonstrate a consistent relationship with the health home for every client in the system? Is that realistic?
So it's aspirational. It's certainly aspirational, and it's something that would be right to do for our clients. You know, to the extent that the resources would be available and the funding would be available, we'd want to pursue that. Right now, I know that what we're doing in terms of MRT funding in order to support clients to exit shelter, it's very small scale, right? So we have a very small pilot that we're using, but for those who we have been able to connect to MRT funds in order to access permanent housing and support them therein, either through a health home or another provider, then we've been doing it. We'd like to expand it, but right now I think we're waiting for there to be more opportunity to do so.
Right.
So to the extent that Steve is successful, you know, we'll be right there waiting for it, Steve.
Right. Good. That's a complicated one. It's a very good question. Yeah.
Hi, I'm Johanna Wasselhott from the Safe Horizon Street Work Project, and my question, along the lines of individualized approaches, not one size fits all, I'm actually curious about your position, Steve, thanks, on harm reduction. In one sense, from HRA, when people apply for public assistance, either back to work or WeCare, if they disclose any substance use, then they're automatically mandated to abstinence-based drug treatment programs. And from the supportive housing world, POP-E, supportive housing, harm reduction housing, has been hugely successful, but there's very limited. And if people have a mental health diagnosis or if people are applying for family supportive housing, there's no harm reduction option available to them. So curious about your thoughts on harm reduction.
So just to summarize the question was about how does HRA think about some of the complexities of dealing with clients that present to HRA that are using or actually introduced to the system through a harm reduction program, and if there are a limited number of tracks for that client population, we're obviously pleased that folks are using a harm reduction methodology to keep them safe, but they also could butt heads against legislative and regulatory stuff at HRA.
The issues relating to harm reduction, I mean, in our HARSA program, in consultation with Vocal and others, I think we had prior to my tenure, we adopted, I think, a good approach on harm reduction. In terms of other HRA programs, we're looking at how it's worked in HASA and evaluating how that might be a piece of our upcoming employment plan. Whether we're going to be ready or not in the time frame of the next couple of weeks, I'm not sure. It's been, as I said, it's been a busy 9 weeks, but it's certainly something that I didn't forget all the stuff I know about this issue in the last couple of weeks, and it's certainly something that's being evaluated for some of the changes that we're looking at.
Anything else to add? You will.
I'm sorry, and I should say it's being evaluated based upon the success in terms of the HASA program.
Mm-hmm.
Hi, my name is Scott Allwater, and I'm with Bronx Works. Since this is a supportive housing conference, I want to ask a question about supportive housing with families. Bronx Works runs 3 family shelters, and right now I would estimate that almost a third of the clients that live in our shelters are not employable because the head of household has either a serious mental illness, a serious substance abuse problem, or a serious physical disability. You know, so these are not folks that are going to be able to go out and get a job and be able to afford their own apartment, or they won't qualify for the subsidy that's been talked about. I mean, the other thing that really I think all of us who run family shelters are shocked by is the number of people living in our buildings that have been in the shelter system once or twice or 3 times or 4 times before. I recently looked at data from one of our shelters, and almost 40% of the clients were first in the shelter system before 2005 when there was a Section 8 rent subsidy. and somehow it's screwed up and they're back into the shelter. So I guess my question is, what are we doing to expand supportive housing for families with children?
I think Scott used his outside voice, so. So I think the question is supportive housing for families and families that clearly have barriers to work, which would in turn lead to independence. Commissioner Taylor, you want to start on that one?
I do. So, Steve, to your question, clearly, if there are supportive housing models that are available for families, we'd want to pursue them for the population that you're describing. I know that there are some that I've been told about, but very limited numbers. It is for that reason that the subsidy that I was talking about in my initial remarks related to vulnerable populations, that's being targeted exactly for the clients that you just described, for the episodic users, for those who have been in shelter on more than one occasion, for those who we know need some additional support, if not as part of a residential component, then certainly as part of aftercare subsequent to them exiting shelter, right? And what that aftercare looks like is something that we're looking to develop, right? And we're looking to understand how can we make sure that it's tailored for the needs of those families who have multi-system involvement, who have young children to care for, who may have true long-standing barriers that prevent them from either being stably housed or maintaining permanent employment. How can we ensure that they have services available to them once they exit shelter to support them in maintaining them in their housing? That vulnerable population subsidy is what we're working to pursue. So hopefully we're successful in getting the funding for it, right? And that's funding that we're attempting to pull down from some modifications within our own portfolio and reallocating and reinvesting. If it's successful, then hopefully we can get more money from the state in order to expand that program.
And that's, just to add to that, I mean, that's where, there's a significant amount of money that's potentially there for that. I mean, upwards of, I think it's $60 million. $60 million a year if it's successful in doing these offsets. So that, but it raises another point that you raised another point that I think is something that is important to be looking at is, increasingly because of the limitations in the system, more and more families are in the cluster site setting, and that's just a function of the limited facilities that we have, and that's where the flexibility in the system is. Those families, it's more difficult to reach in terms of mental health services, and so I'm looking forward to working with Commissioner Taylor on expanding or most effectively delivering mental health services to those families that are outside of the Tier 2 setting, but are in the cluster setting. But we really do need to start looking, I think, long-term and broadly at how we're able to deliver mental health services to these vulnerable populations. I think it's something that we do need to focus on more.
Commissioner Beck, do you want to comment on this too, since you see so many special populations, including DV and folks through We Care?
Well, I think working, with Commissioner Taylor on the subsidy that he spoke about is certainly a piece of it, but a lot of the conversations that people have been having with us about additional supported housing development has included exactly the population that Scott's talking about. The input from the community that I'm getting is, to the extent that there's a future program, this has to be taken into account, and I think that that's a good point.
Hi, I'm Lauren Preddy with Housing Innovations, and my question is sort of the opposite end of the spectrum as Scott's question. Because there haven't to date really been good predictive models to help us determine which of the many, many families that are experiencing housing crises are actually going to end up at the front door of the system at the PATH office, many communities around the country are really looking at investing more and more rather than in further upstream prevention services in rapid rehousing services. And so my question is, and I haven't heard much talk about rapid rehousing today, and so my question is how and whether rapid rehousing strategies, so short and medium-term rental assistance coupled with time-limited supports, are part of the plan.
So the work that we're doing related to expanding our home-based model, structurally speaking, what we're looking to do is to co-locate as many of those new offices with HRA, and to really find ways in which we can have them be in communities where there's more than just one or two service referral organizations in the same site as the home-based office, right? So we're being very ambitious, and we think that if there is a way in which we can have resources available to families who are faced with housing instability in the moment when they're actually presenting. So if there's someone there who can cut the check that day, or if there's someone there who can say, well, come back and we'll cut the check in order to help you, to stave off whatever financial crisis you may be having that may be threatening you with eviction, we think that we're going to be able to hopefully yield greater success. So not just having the standalone home-based offices, which we have now, but really making sure that they're wrapped around and partnered with, first with HRA, and I know that Commissioner Banks and I have talked about this, and we're looking at ways in which we can have a model that has at least those two components, but then other service providers who could also be part of that equation in the communities in which our families are presenting. And getting the word out and letting people know that we have more, letting them know what value added and what the difference will be and what concrete steps they can expect to have when they come to our offices seeking help.
Councilman, you want to add something?
Yeah, just one quick thing is that both commissioners have been working towards is expanding the FEPS program, and that's something that I think is working with families at that stage of, on the precipice of homelessness, I think is something that both have been working towards and that we're very supportive in the council.
But Commissioner Taylor, just inherently in that question, there was the question about, are you pessimistic about whether or not home base, if expanded, stays to be somewhat inefficient in terms of being able to target effectively, or do you think that it's actually doing what it's supposed to do?
No, home base is doing what it's supposed to be doing.
Yeah.
I really believe from what I've read and from what I've observed that they are targeting most appropriately. I think that their efforts can be supported by having on-site services that can concretely deliver what clients need when they're there seeking home-based intervention.
Yeah, Commissioner Banks.
Right, and in the partnership approach to having HRA staff right there was to avoid the problem that came up at the beginning of these remarks or this panel in terms of the sense from clients of having to go among a number of different places. So if we can have HRA staff right there to be able to have the client have an understanding right then and there what is going to be able to be provided in terms of rental assistance, that's a better model. And so that's certainly something, again, that reflects the two agencies saying, you know what, the sum of our activities together is going to be much greater than if we do it alone.
Yes, my name is Karen Jorgensen. I'm from Westside Federation for Senior Supportive Housing. I'm the director of Valley Lodge, a TSH shelter for people 50 and over. And my question is about prevention. And one of the key groups that I see coming in are older people whose rent is now equal to their income. And there is nothing that is saving them because they're underage for SCREE, or by the time they reach the SCREE age, their rent is as same as their income. And there is nothing, FEPS will not help them. People have talked about a different kind of SCREE program that could be developed by the city council or the city. Otherwise, these folks come into the shelter system and they are really the economic homeless. They are not necessarily mentally ill. Some of them have city pensions. So I'm wondering what we're doing about that group.
So the question was essentially boiled down, and tell me if I've got it right, what do we do about a growing population of seniors whose rent outpaces their fixed income?
And under people 50 and over, not even seniors.
Okay. Yeah, I think they got it.
I mean, two things is we need to really take advantage of right now the position that we have with the new housing plan to start building senior housing again. We haven't built senior housing after the 202 program has not been effective because of lack of federal resources. We need to look at how the city can build and support more robust senior housing. And speaking to that, I mean, I've seen the same instance where seniors that are in my district in Greenpoint that are getting evicted because they're not in rent stabilized housing. It's not just that they wouldn't qualify for SCREE, it's that they're in smaller 3-family or 4-family buildings. And I think that really seriously we need to start talking about this on a broader level in terms of rent regulation and how we can protect seniors in smaller buildings. I think that, I mean, rent stabilization is a good program, but it doesn't go far enough.
But may I interrupt though, because I see people in rent stabilized housing
202, right.
So I don't think anyone would disagree with what you're saying. No one on this table, right? And the reality is, it's a matter of us really understanding what resources then would be available for that population, and whether those resources would come from HRA or would they come from some other city agency. Dept comes to mind. Are there ways in which we can leverage city resources in order to effectively stave off housing instability for that group, right? Because if there's some income coming in, maybe this is another subsidy that I'm not yet talking about, right? Well, so I hope I will be too, because you know what? The reality is we have to start someplace, and I'm happy to say that at least since the state budget was passed, at least now I can have this conversation, right? I couldn't really have it about reinvesting state money into subsidy because a couple of weeks ago it wasn't allowed, right? So now that it is, we have to really consider, well, how do we look at all the resources that we have across our system, and how do we reallocate them in order to best meet the needs of the various populations that we serve, including the population that you're referencing.
Home base, if they could get involved in helping people with that kind of subsidy before they get to the assistance.
I would agree. Okay.
So I think that's a good high note. So we made it exactly on time. Can I just say, in closing, you all are here and we're interested in coming to this session because you recognize the complexity and the severity of what's going on in New York City as a relationship to the homelessness issue. And I think that all of us should give these three guys a round of applause, both for their commitment and where they're going.